been mixing, I've been sipping. Since I've been 20 on that lean, baby girl, I've been popping and I've been rolling. Since I was 17, I've been geeking on that wine.
Aid their academic success? I can't see how. I don't know that much about it. A cup of coffee won't work.
I don't know.
Espresso.
The earth to poke Catholics in the ash for SARS and knock blunt ashes into the. I'm asking it. Them two dope boys. I preach Wolfgang, kill them all. Don't.
Do you have a prescription for Xanax?
No, sir.
With codeine. Call me Mr. Sandman. I'm selling all these dreams.
Prescription drug abuse is an issue, and a dangerous one at that. Students abuse pills like Percocet, Oxycontin, Xanax, and Adderall recreationally, and even to aid academic success. It's glorified by the media and the music industry and taking over our community's drug scene. We spoke to a few of Croatan's administration about their thoughts on the issue.
I personally have not heard of any specific incidences of that here. However, it is completely conceivable that it would be going on.
I don't know that answer. I'm sure that we probably have some that will try it. They could get an advantage. And I think all schools will have an element of people that will try to use prescription drugs to get high.
We also asked some Croatan students if they thought their peers used drugs to pass tests and succeed in school. These were some of their responses.
Absolutely. I mean, everybody gets that study crunch in and they want their Adderall, to get smart.
Probably in class, yes, more so in passing, but I do believe that I've heard things talked about in different classes, yes.
Yes, because there's a lot of pressure to do well at Croatan, so some kids resort to this.
We know there are ways to prevent people from abusing prescription drugs. We had the opportunity to speak with Dr. Stevens about what precautions he takes to keep his patients from drug abuse.
We obtain prescription drugs are a problem in this area. They're a problem in the country. The ones that I'm most familiar with are narcotics, because that's a drug that we deal with on a regular basis. But it's certainly a problem in this area.
What precautions do you take to avoid prescription drugs from being abused?
The main ones is that we don't use pre-printed prescription pads. Our prescriptions are all written or printed out on prescription safety paper that can't be copied without having void written all over it. If they try to wash the ink off the prescription paper, it's a permanent thing. They can't just rinse the ink off and change the prescription. So we don't use pre-printed pads. The other thing that we have that we use is state online computer control system for diversion control. If there's ever a question about the patient's behavior, perhaps maybe they are seeking drugs, before we write the prescription, we go on to diversion control, and you put in the patient's information, and it'll quickly give you a report of the narcotic prescriptions that they've received over a given period of time and which pharmacies have filled them. So it's easy for us to determine if a patient has drug-seeking behavior.
We also spoke with pharmacist Dan Udy about the side effects of popular prescription drugs.
Right now, Carteret County law enforcement is starting a MEDS, Drug Education and Abuse Prevention Program. We spoke with Officer Vince Santoro about his experience with drug-related crime.
Too often we're arresting children and young adults for this use of these drugs. They don't realize what they're getting themselves into until it's too late. And unfortunately, at that point, there's nothing they can do.
Yeah. How often do you arrest high school students for the possession of illegal prescription drugs?
Maybe once a week, maybe.
Mm-hmm.
Yeah. And that's just the ones we know about.
Yeah, the ones that you've actually caught doing
right.
it.
How many are doing it that we don't know?
Mm-hmm.
We also had the opportunity to speak with Carteret County Sheriff Asa Buck.
It's a significant, major problem in our county and other counties as well, with regards across all age groups, but especially with our younger population. The problem with prescription drug abuse is a lot of it has to do with people's mindsets. A lot of people think or assume mistakenly that because you go to a doctor and get a substance, a prescription drug or medication, you go to a pharmacist and have that filled. Most people use these medicines to help them.
Yeah.
So they think that these drugs are safe, when in fact it's the exact opposite.
I had a Xanax problem because I got it prescribed for my anxiety, and I also had a pretty bad time with a drug called Suboxone, and pretty much it's like a opiate blocker, so it's for people who are addicted to heroin or strong pain pills and they're going through withdrawals, and they give it to them to wean them off of the drugs, and it has a recreational potential. And I got a hold of a strip of Suboxone, and I ended up sleeping on a dock somewhere. I don't even know where I was. My phone was dead, and I was with some other girl, and we were both just woke up and just felt so froggy after being so messed up all night, and I just woke up and threw up all in the water, and I just remember going to the beach that day and just throwing up all day and just sleeping. Walking through the hallways, I can overhear people talking about it. It's not a good thing. I mean, I try to keep my friends away from that as much as possible, but
kiss in the living room, that's a hella way to end it.